I'm coming.
I need your help.
Do not try this at home if you do not know what you're doing, because it could go really bad.
Leave it alone, boo-boo. The eye is gonna get hurt.
This is my first pencil. Would you guys like some?
For breakfast today is pancit canton and fresh pandesal. Apparently, the way to eat this properly is you put the pancit canton inside the pandesal. I've never had it this way. Okay, here we go. Usual, the fruits, mango, hard-boiled eggs.
And this orange is different.
Yeah, and some oranges. What do you like about the pandesal?
The peanut butter and the pencil.
Oh, okay. You like the combination. Sky, what are you eating now?
Egg. Hey guys, welcome back to the channel. Today we're out here and a lot of people are missing here. And they're all outside today and then blah 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 blah. Today we're eating breakfast.
Breakfast.
What's mommy eating?
Canned mango.
What are you eating?
Canned mango, orange, egg whites, and penicillin. And peanut butter. Look what's inside you. Peanut butter. These are all sweet oranges. I love them so much. We're doing a Q and A. Say it.
Q&A.
Q&A.
I say egg. Here have some milk.
This is good for 6 months. This is good for 2 weeks.
So, do you have your supply?
Yeah, I have a free medication for 6 months, courtesy of OHIP of Ontario.
So, what happens after 6 months?
Supposed to be I should go back to Canada before I could avail again for another 6 months.
So,
free medication.
Do you have plans of going back after 6 months?
It depends. I'll see how it goes. I have 20% discount as a senior citizen here in the Philippines.
So, if you don't go back after 6 months, then you're planning to purchase the rest of your medications here?
Yeah, I can buy my medication here. I already researched on the pricing of all this medicine, and it's not that much compared to
how much you're paying
prices in Canada.
Oh, okay. How much are you paying pag OHIP? Free?
Most of them are free except for some medication like prescribed vitamins. I pay only a prescription fee of $5 each.
Each medication?
Each prescription. So if the prescription is good for 6 months, I pay only $5 for 6 months for each medication. I have 4 normal medication. So I pay only $20 for 6 months supply of normal medication. Supposed to be, if you're in Canada, you're entitled only for 3 months. But if you're going away for extended period of time, you can ask your doctor and the pharmacist to give you a 6-month supply.
Do you have a plan in case you don't go back for 6 months?
If I don't go back, the cost of medication is not that much if I have to take into account the 20% discount as a senior citizen.
Yeah. Plus, you have to pay the plane ticket and all that stuff. It's gonna be more.
Yeah, that's what I factor in. If I pay for the plane ticket, it's more or less the same. If you pay for return ticket, you can, offset the cost of medication you buy in the Philippines. Only on major health issues, probably surgeries, it is practical to go back to Canada.
And hopefully, with the types of food that you eat here, you don't have to take as many of these.
Yeah.
Kayo, do you have any medication pala?
Mayroon naman ako, dalawa lang. Yun, para blood sugar ko at saka cholesterol. Inisip ko nga na magda-diet na lang ako, mga fruits na lang kakainin ko, vegetables, para hindi na ako uminom ng yung gamot na yun. Kasi sa akin, nasa border lang naman ako, pwede naman ako maalis yan kung kakain lang ako ng proper diet.
Okay, this is our makeshift IV pole.
Not something. Oh, I know. So this is our makeshift tourniquet right here. So we need to clean. So this needs to be as sterile as possible when you're putting an IV.
Do we need two?
Okay, do this side. This guy wants to help too. Okay, that's good.
Do you need help?
No, right now, boo-boo.
This is what we're doing at 9 p.m. Si Mama nagtatago. You saw a hole there at the bottom of his feet?
Yeah. Look, I'm putting this on.
Good.
Yo.
Okay, there was a hole there before.
Yeah.
Show me.
He stepped in a nail.
Oh, there's a hole. Okay, now we can close it again. Thank you, Dr. Sky.
Just in case. Okay.
Let's try to.
Hey there, Sky's opening it.
We'll just put it right here so that my protection should just in case ma-poop. Make it stick.
Yo.
Yep, that's perfect. Kasi kung na sobrang dehydrated, nagtatago yung mga veins, ang hirap hanapin minsan yung mga. Where's that blood pressure machine? Where's my helper? Oh, there you are.
I thank you, Sky.
Thank you, boo boo.
But some people do it like this. The number. The number. I vote. I vote.
After po nito, kung mas maganda na yung sikmura niya after this medication, then you can take your blood pressure medication.
Oh.
Yeah, just let this finish and then I'll put the saline after.
Asan yung mga kamot mo sa baba?
So there's no point taking the medication and you vomit it out right away.
Ito yung kamot mo sa baba.
And we'll just leave this. I'll check your blood pressure again mamaya.
Doc, Sky.
What did Papa say? Our job here is done.
The next day.
Let's go and take out our patient. And I have a tea for him.
Can you see? What's this?
Play-Doh.
Okay.
Play-Doh. No!
Yeah, he's downstairs.
Patient is gone.
What the? He's healed. He's discharged.
Yeah, I think he was discharged yesterday.
He checked himself out though.
Yeah, it's called an AMA, against medical.
Against medical advice, he left the room and got discharged. So we're gonna look for him in the house.
Oh, patient's looking good.
I'm nursing assistant.
So I took out the IV this morning. He had a total of 1 liter of slow infusion of normal saline. So just to prevent dehydration. And it worked. Look, the patient discharged himself.
I say at least 12,000 grand. Last time I went to the hospital, same diarrhea and vomiting. Cost me 22,000 grand for 2 nights.
So 2 years ago, my dad went back home here in the Philippines, and the exact same thing happened to him. He ate. What did you eat?
Boiled peanut, buko, green mango, and
All in one day.
all in one day.
So it was also diarrhea, vomiting, and then he had to go to the hospital and stay there for 2 nights, like he said.
The thing is, when I check out, I'm entitled to 40% discount,
Cause senior.
20% discount from pill health, and 20% on medication. So basically, I paid only 60% of the total hospital bill. That's the case for seniors. If a senior is hospitalized, you pay only 60% of the hospital bill. So you're saving 40%. So you factor it versus if you are hospitalized in Canada, you pay nothing. Here you pay 60%.
The moral of the story is don't eat
Too much.
Too much.
too much in one sitting, especially if you haven't had it in a while, and boil your oysters.
So I myself had diarrhea. Just the diarrhea though. Well, you didn't have it.
No.
So you didn't eat.
0.
So
Same as
only
Sky.
us 3 got affected.
You had a mild one, right? Are we back to normal or?
Medyo naninigas pa yung tiyan ko.
Leftover,
Yeah.
Mukhang matigas nga.
Tigas lang.
So my mom only ate 1 piece of oyster, and she felt it right away, and she recovered within a day. It was only 1 piece, and you guys ate like a whole bucket.
Afternoon, we again ate oyster here.
Yeah.
We finished the.
It's good. It's a good thing that Sky and I didn't eat it, because if everyone is sick, it's like no one's gonna be able to take care of each other. And also, it's a good thing that only had diarrhea.
Okay guys, so I just wanted to say something about that medical procedure that I did yesterday. Well, it's not a medical procedure, it's more like a little intervention. So usually you'd need a doctor's orders for these type of things, but that was unconventional what I did. And I have been treating a lot of people in Emerge and then in surgery in terms of dehydration. So I've been a nurse for about 12 years, and putting the IV, I've been doing that for like almost 11, 12 years.
So relatively, this is like a simple intervention.
So for me, this was very simple. But guys, do not try this at home if you do not know what you're doing, because it could go really, really, really bad. The other thing is, yeah, if you're not using aseptic technique, you might cause infection. Of course, I also monitored the patient the whole night. So I took his blood pressure before doing the intervention. After doing the intervention, I woke up at like 12 midnight to check up on him to make sure he's okay. And blood pressure was good, vital sign was okay. So, and then in the morning, I checked the blood pressure again, all good. So it's like back to normal over there. So I just had to do what I did just because he was vomiting so much every time. Like he would be on the verge of like being so dehydrated that he would have probably gone to the hospital this morning if he didn't get IV fluids. Like I don't recommend this for you to do this for like family members, but if you are having symptoms like this and you then start getting lightheaded, level of consciousness is kind of dropping a little bit, like no energy, and then if you just don't feel good, go straight to emerge, because they'll need to give you IV fluids, they need to give you IV medications for the nausea to help you and all that stuff as well. So what did we give him? We gave him IV Gravel. So we gave him IV Gravel last night. I also ran a slow infusion of normal saline, and yeah, it helped for sure with the dehydration, because look at him, he's okay now. Sweet. I want to personally thank my assistant right here, my beautiful assistant, for helping me set up the IV yesterday and doing all the blood pressure and all that stuff.
And putting the bandage and Papa's
Yeah,
foot,
you put the
hole in
bandage.
the foot.
She actually stabilized the IV as well with the band-aid. So thank you, Sky.
We're checking up on my dad and see how he is. Let's say, knock on wood, a medical emergency much worse than this happens. Knock on wood. Or something like this happens again, right? What is your plan? How do you plan to, because you wouldn't have a private nurse, but what if it's just you guys in San Jose? What do you plan to do? How do you?
Dapat mag-set aside ka ng fund para in case kung mangyari ulit na nangyari kagabi, may pwede may dala doon sa private hospital. Kailangan may sasakyan ka papunta doon. Dapat mag-set aside kayo ng money na hindi nyo kukunin. But in case na may mangyari, mayroon kang dudukutin na hindi ka naman hihiram sa iba. Mayroon lang, ilagay mo lang yan sa lalagyan mo.
Ilagay mo sa lalagyan mo.
Iniisip na namin magkaroon ng health coverage para pag halimbawa kung magkasakit, pag sa hospital hindi kami maraming babayaran sa medicine, sa drugs. Yun ang pinaplano namin.
So today we were supposed to do a Q&A to answer some of your questions regarding our future here, what we plan to do, and how we plan to address some of the issues. But things happened and we didn't get to do that. We will film that tomorrow and hopefully it'll clarify a lot of things. And for now, we are gonna say
Simple life we in.
Simple life we out.
Simple life, we're out.
The time I got, it is just enough to get by.